what I expected out of this meeting was some resolutions based on certain topics that we are going to cover. I'm extremely interested in the nursing examination of the CARICOM region, the RENR exam. That's one part of it. The other parts of it, the HIV, sexually transmitted diseases, that part of it, we are also having a bit of difficulty with bringing it, as I say, into one complete center in Trinidad and Tobago. So I was trying to find that out. I'm also trying to look into a very unusual aspect of the tobacco control system, where I needed some ideas on the development of utilizing smoking areas in offshore drills, which are places of the workplaces. So I'm hoping to get some sort of input and answers on that. Problem I see with NCDs in Trinidad and Tobago, the education aspect of it is good. We are trying our best to develop the education movement into showing the population that the cost of the health budget of the diseases of NCDs, the diabetes, the cardiac diseases, the hypertension, etc., and the strokes and respiratory illnesses, that the cost to the population is so great that if there is a preventative mode, that cost will decrease, and healthy lifestyles and proper diet will definitely decrease the long-term effect of the non-communicable diseases. The challenge I do see to it, Trinidad has become a fast food nation, and we are looking at the dietary habits of the children that are growing up, the adults, young adults, and the level of obesity that's taking place. So the challenge I see, and I think PAHO could help, in developing a strategy to show that NCDs come about as what we're doing now as a result of poor diet. Now, when we say the word poor diet and eat more vegetables, the real root of the problem, which I understand we need to address, would be like looking at the sugar consumption and, as I say, targeting sugar consumption rather than so much fat consumption, and the development of empty calories over a very short space of time, processed foods. So I think we need to be a little more specific now that we have sent out the overall picture, and specificity in dealing with the problems that cause NCDs, the prevention, needs to be more specific. So we have started by a cabinet decision and a cabinet committee for the Partners Forum. It's private sector and public sector that have joined together to develop certain protocols looking into the dietary habits and putting together dietary regulations for the country itself. So I think we've done a lot with that. What I do hope to do would be to utilize the private sector also and develop advertisements that will show not just normal ministerial billboards, but billboards that will evoke certain fair responses, FEAR, and people who do partake in certain food patterns, and also what the complications of the NCDs will do if one does not take care of it now. Viral hepatitis is not a very great concern in Trinidad and Tobago. However, we have been on a campaign for the vaccination of hepatitis vaccines. It is not a vaccine that is promoted as much as the other vaccines. We have started a vaccination program of the HPV vaccine for young 11 and 12-year-olds. But to say viral hepatitis being a problem, it is not much of a problem in Trinidad and Tobago. Our main, I think, challenge is the training of the district health visitors. You see, if you're going to approach the development of integrated child health, one has to do it as early as you can. In fact, I think it starts in the antenatal care. And once we are able to train more district health visitors, and we are doing that now, the Ministry of Tertiary Education and Skills Training, they have taken it on board to train more, as I say, district health visitors and midwives. So taking care of the young children, as I say, from antenatal care onwards. We also put in a special emphasis on breastfeeding. And what we have seen, and from the studies that are coming out, the breastfeeding approach, the antenatal care approach, together with that area, that age group, it's responding quite well to decreasing the mortality of infants as well as toddlers. The other age group, as you get older, the 5 years and around that area, there is a challenge because we don't have enough pediatricians, and we don't have enough, as I say, nurse pediatricians or that level. But they are being trained at this time as we speak. I am glad you asked about e-health, and in fact I have taken that on board. What I'm trying to do is to develop a program of telemedicine with teleradiology, together with utilizing registration with electronic medical records. I have recently spoken to the IT people in the ministry. What they were trying to do, they were trying to do it on their own. But I've asked them to break it up into small compartments and expand it around the country itself. And I'm thinking that we may be able to use the cloud service to develop that movement of, instead of having a local area only, utilize the cloud service and develop the electronic medical records together with, at the same time, lab results, investigations, as well as x-rays. Telemedicine, I'm also looking into telemedicine because I've recently signed an approval with Cabinet for telemedicine to be beamed, as I say, to external sources and to, let's say, universities in Canada, with University of West Indies, and our regional health authorities. I'm linking them up with telemedicine. There's a shortage of pathologists in Trinidad and Tobago. So I'm using the telemedicine e-health system, where we could put systems in the areas where the slides are being processed, and, as I say, beam it to areas such as United States, Colombia, Venezuela, and India, where they could read the slides, send back reports. And I'm doing the same thing for reports on radiology. So that is coming on. Communication in health is very important, because if you don't utilize the communication methods properly, you will not get your message across, or people will pass it very fast. In a form of advertising, that's one part of it, I tend to look for specialists in the area, and I have focus groups, and I do ask, what do you think of this? What do you see in this? What do you not see in it? As well as utilizing the development of the TV ads. But I'm really, really strong on the social media. I communicate a lot on social media. That is my forte with my ministry. I'm able to reach a younger age group with that. I receive a lot of hits, and may I also say I have also utilized the social media to develop what I call the virtual medical library. And what we have done with EBSCO Host in Trinidad was allow everybody in the country to go online and utilize the EBSCO Host for any journal that they so desire. In fact, the ministry pays for it. In fact, we're one of the first countries to do it, and I see Brazil now has now developed the same process with their professionals. So communication, I think we're going into the area of social communication, social media communication. Very soon, I may say, in the next 10, 15 years, when the older people have passed on or have gotten older, as I say, visual ads will not be as needed as the social media ads. That's where the net generation is going. And I think that's where I'm targeting early. I see CARFA, the development of CARFA, as the single important factor in public health for the future of the CARICOM. That's how I see it. When I saw it, I realized this is what we need to put a lot of effort into. All it has been floating around for about 11 years. So I've taken it on board, and in fact I asked the Prime Minister and the Cabinet if they will host CARFA, and I've gone so far as to said, would it be okay if we spend the money up front to build the compound, the building and equip it and have it running and collect water afterwards. Because I think CARFA is going to be the movement, the leader in the CARICOM, and it has to be done fast.